Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello and welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host. Today it brings me great pleasure to introduce you to Dr. Adriana Corredor, co-founder of our clinic, the Stewart Center for Optimal Health in Flower Mound, Texas. Dr. Corredor, welcome. Good to have you here.
Thank you. Good to be here.
At the Stewart Center, Dr. Corredor and I, we specialize, we do general dentistry, but our real passion and our subspecialty is craniofacial growth in children and as well as adults. We've expanded our service to treat infants as well. Believe it or not, we can see potential issues coming in the growth and development of a child even at the time they're born. Tell us a little bit about that. Dr. Corredor, a young couple, they have their first child. It's breathing, color's good, heart's good. What's the next thing that we should look for in that child?
Oh, absolutely. That's an easy answer, and that would be the tongue.
Why is the tongue so important for an infant?
Because mouth development is crucial, and that's where it all starts. And so as an infant, we are all born with tissues. We're all born with frenulums.
What are frenulums?
Frenulums are a little thin tissue that can attach, or that does attach, the tongue to the bottom of the mouth, but you can also have it on the lip. And so that can affect greatly a baby on the way it's going to later speak, but at first off of life on how it will feed. So it's crucial for eating and speaking later on in life. And so we are born with that. And as a matter of fact, all babies are born with it, but about 3% to 15% of the babies are born when that tissue is too tight. And so it's not about the presence of having this tissue. It's more importantly about the function and the effects that it has on the tongue, the restriction, any mobility restrictions on the tongue or restrictions on the mouth, for that matter.
So we all have the frenum, the little attachment of the tongue when you lift your tongue up, or on our lip when you lift your lip up. We all have that.
Yes.
So what constitutes, when we say a tongue tie, it doesn't necessarily have to be just the tip of the tongue that's tied down. An infant can still have a tongue tie that is dysfunctional. And how would a parent know that?
Well, a lot of parents may not know that, but things to look out for would be breastfeeding. It would be the way the baby latches on to the breast. If they're bottle feeding, the way it latches around the nipple of the bottle. There are things to look out for. If the infant is having problems feeding, if it's having problems where the milk is coming out on the corners of the mouth, that would indicate that there is not a proper latch that is occurring. Why? Because the tongue is restricted. And it's about the placement of the tongue has to be in the right place in order for that correct latch to occur.
Well, if a parent, they have a child, the new child born, they take the child home. Nobody's checked it for a tongue restriction. What should they do? The baby's 2 days old, and even if it's not having any of these issues, would you recommend that they still have it checked?
They can. Again, it's not about having the presence of it, seeing it. It's about if there's any symptoms. We go by symptoms. So if I have an infant that comes in and parents are a little concerned, they see it, you have to be careful, be mindful of what you hear, what you see online, because there's a lot of misinformation out there. But if I took a picture of an infant and a parent would be suspected that they might be tongue-tied, I cannot make that correct assessment off a picture, because it's more about checking the mobility, whether it's lateralization is occurring, the tongue tongue has been moving from side to side, or it's lifting to make the correct seal. And so again, it's about, is there a symptom? Is there an issue that is occurring? Is the baby not being able to feed properly? Or on the other end, is the mother having issues? Is she having sore nipples? I mean, is she having where it's traumatizing to her, painful, blistering? There's certain things that you can, so there's a whole list of things that you can look for. If somebody brought me an infant, I've seen infants where they have that attachment. Does it mean it needs to be released? No. Only if there are problems or issues with the baby feeding, or if mother is having painful issues where she can't, or it's too painful. Because then I also try to educate patients, as you well know, that later on that those tethered tissues can present problems later on in development. And so it doesn't mean that that later on they may not have to be released. What we look for is problems, symptoms that would indicate for the release to be done.
So if a child has a tethered tongue, if they have a tongue tie, what are some of the ramifications long term? You've talked about they might not be able to feed correctly or nurse correctly. So what's the importance of nursing from a mother's breast versus just why not just give them a bottle?
Right, and it has to do with the placement of the tongue. When the tongue is not restricted and it can move and it can do its proper movements, then it can create a proper seal on the roof of the mouth. And so it's very different to breastfeed than to bottle feed because of the function, the suction that occurs. So we want to promote nasal breathing. And in order to have nasal breathing, that tongue has to be able to lift up to the roof of the mouth. And so that's why it's so important to teach this early on, because a child can go through life with a dysfunctional tongue, not knowing that they have it because they adapt and they compensate, but they never learn to properly raise the tongue. The tongue has poor tone, has poor posture, and that later on may affect the way the child breathes. They become mouth breathers, and now you start a whole vicious cycle of other issues, but especially for growth and development, because that so adversely affects a child, the way they develop undersized jaws, crowding later on, and other health issues that come along with that.
How does the tongue affect the growth of the jaws?
Well, if the tongue is not used properly, I love your saying, if you don't use it, you lose it. And so if you don't use your tongue properly to form a seal, a proper seal on the roof of the mouth, it doesn't push out, it doesn't create the ideal form of our jaws. And we need big jaws. We need the proper widths to house the tongue, so that later in life, the tongue doesn't restrict our airways. And so it's all important about development, but also, as a result, to have proper airway development.
So the tongue is more or less the scaffolding of the jaw.
Yes,
if the tongue's not pushing up and out, that child's jaw won't develop properly.
Correct.
So you get children with narrow jaws, crowded teeth. Or crowded teeth, we know they're kind of the norm, but is that healthy? I mean,
no.
is that it? Something that's normal doesn't mean it's healthy.
Absolutely.
Yeah. And
we see it a lot. And the majority of kids go through life, they'll end up at the orthodontist to correct their misalignment or their crowded teeth. But if we can catch this, that's why early detection is so important. And if we can catch this as an infant at birth and release that tongue tie that will later have a negative impact on their life, you can change a child's life.
Yeah.
Immediately. You take a set of twins, and if one had a tongue tie and the other one did not, and one that did have the tongue tie wasn't released, you can guarantee that these two individuals will grow and develop completely different.
Yeah.
And so, as a parent, we want to equip our kids with, everything that we can so that it encourages proper growth and development. And that's one thing. That is one thing that as a parent we can do. We can educate parents to learn more about this. There's two great books I love that Diane Barr. She's a certified speech and language specialist. I'm going to hold them up because this is like my Bible. There's so much information in here. She's got 2 great books.
Is that a great book for a parent to read?
For a parent,
yeah.
For even dentists or anybody that is wanting to learn. It takes a village to raise a child these days, and there's lactation specialists that can help parents. There's there's a lot of doulas, midwives that are all looking at this and understand the importance of this. And so the more we can help families and educate them and give them a place where they can, learn more about this, the more they can empower their kids. And that's what we want to do. That's our mission.
You said something really, really powerful when you said something as simple as a tongue release with an infant can change the direction of their entire life. And they call me Mr. Analogy or Dr. Analogy at our office. I'm always thinking of analogies. And, we live in a world now where we've got missiles pointed at each other. And I think they said if China released missiles, we would have maybe 30 minutes to counter attack. That's how, but if you've got a missile aimed at a target 1,000 miles away and you're off by just a half a degree, by the time it gets to that target, it's not going to be anywhere close. And my analogy here is that something so simple as releasing a tongue so the tongue can function properly can have a profound impact on that child 50 years down the road.
Yes.
Because the jaws will develop properly.
Yep.
Yeah. And it's something so simple that any parent can do. Take it into a dentist, pediatrician. It just seems like the dentists that specialize in this are more in tune with what really constitutes a dysfunctional tongue tie. But they can really change their child's life forever.
Absolutely.
And my daughter Alexandra is pregnant with her first child, a little boy, and I doubt she's going to want me to be in the delivery room with her, but that's her husband's job. But I'll guarantee you the first thing that I'm going to look at is that child's tongue, and Dr. Corredor is going to.
We will be checking for that. Absolutely. Yes.
So you've talked about what some things parents can look for symptom-wise. If they can't get in to see a dentist, milk coming out the side of the mouth, the mother's nipples sore, the child's not fatigued, they're fatiguing when they nurse. What, in your experience, let's look at what a healthy mouth on an infant would be. What would that look like as far as nursing and how long they nurse? And
Sure. Well, again, movement of the tongue, easy movement. There's, as a matter of fact, there's exercises that you can do for your baby with an infant.
Wow.
There are oral exercises that you can learn what it does, it promotes the tongue, it promotes the tone, the strength, and that's what it's all about. You have to think about infants are like this, and they're all in a weird position when they're in the womb, and when they come out, there's a lot of tension. Sometimes there's a lot of fascia tightness that occurs, and
what is fascia?
That's the muscles throughout your whole body. And so in the very first place that starts is in your tongue. So there's a really cool image that I've seen before.
The muscles or the webbing that connects the muscles? The webbing that connects
the muscles. And it starts at the very tip of the tongue. And it goes all the way down through your body, all the way down to your feet. So you can imagine, if you will, if the tightness is already occurring that early on in the tongue or in that, it just travels down. So body workers are also, I said earlier, it takes a village to raise a kid, because there are so many specialists out there that are there to help parents answer questions, but get them through, these milestones that these children are going to go through. But a lot of times, even as an infant, body workers can help assist with that tightness, because that also can impact the way a baby feeds. And so again, looking out for lateralization of the tongue, movement, cupping, by going in there with your finger. There's certain exercises that you can help. It's all in that book as well, that you can help your baby that will promote that tongue to keep functioning properly. And so in doing sometimes those exercises, when you see that your infant can't do that, that might spark, well, maybe my baby is tongue-tied. Maybe there is an issue. I'm still able to breastfeed and he can feed well and everything, but, is there a problem or is there an issue here? And so again, like I said, early detection, it's all about early detection and knowing and acknowledging what's there.
Yeah. So if parents go back and they look at their infant after hearing this, and they look under the tongue, they're going to see
absolutely
a tether there.
Yes, we all have it.
Yeah.
We all have it. And
so
again,
I don't want you to get alarmed if you go home and look at your infant and they have a tether, but I would get it checked.
Absolutely, yes.
It's an easy check. It's non-invasive at all, and that advice you might get from that healthcare provider would change your child's life forever if your child has a tongue tie, has a tethered tongue.
Absolutely. And after properly assessed, if there is an indication that there's a restriction present, a quick procedure done at the office with a C2O laser can completely have such a positive impact. And it's so important to do it early if it's there, because it can completely change the growth and direction for that child.
Yeah, great. Well, we're going to have Dr. Corredor on again, and we'll talk a little bit more about like pacifiers, bottle feeding, myofunctional therapy for infants and children. We wanted to introduce that today, and we'll be talking more about these subjects in later broadcasts. So, yes. Dr. Corredor, thank you.
Thank you
so much, and we will be learning more about this in the future. So, This has been Health and Harmony Beyond the Teeth with Dr. Hal Stewart and Dr. Adriana Corredor, and we're glad that you were able to tune in today. If you have any questions for us, you can email us at dradriana@thestewartcenter.com or drhal@thestewartcenter.com. Thanks and have a great day.